Are you tired of feeling that nagging rotator cuff pain every time you perform bench press, push-ups, or dips? Maybe you just want to build a solid shoulder warm-up routine. Regardless of your reason for watching this video, I've got you covered. Make sure you stay tuned to the end of the video, because at the end of the video, we're going to discuss some ways in which we can bulletproof and stabilize our shoulder using calisthenics. After visiting countless specialists and receiving many treatments, including chiro, physio, massage, acupuncture, laser therapy, and shockwave, it still didn't solve the problem. While it did provide immense relief, it was my responsibility to solve this issue for good. The shoulder joint is complex, but it's my intention that after watching this video and sampling these exercises, that you'll be able to get to the root cause of your rotator cuff issues. Though, as always, if you are unsure of your particular diagnosis or experience any pain or discomfort performing any of these exercises, please consult with a doctor. Step number 1 is going to be mobility and flexibility. But very briefly, I just want to touch on the difference between the two. Mobility is defined as the capacity or space that a joint has to move freely, whereas flexibility is the ability of joints, muscles, and tissues to move through a full range of motion without pain or restriction, or rather the lengthening of a particular muscle or muscle group. This is what's happening with our shoulder. When we don't have enough space in our joint, that's when impingement is likely to occur. And this can sometimes be caused by stiff or constricting muscle fibers. But working our way backwards, we need to lengthen before strengthening and stabilizing the joint. And that's where flexibility comes in. A lot of times, the culprit can actually be tight traps, which then causes tension on the levator scapula muscle, causing us to pull our shoulder into a position very prone to injury. Some other areas that I've noticed could benefit from increased flexibility are the pec minor, teres minor, and teres major. So before we discuss how to solve this issue, let's first discuss how this tension occurs so that it doesn't happen again. The first is poor posture, and this is usually caused by long hours sitting at a desk with our heads forward and our shoulders rounded. Going forward, try to remember to take frequent breaks and stretch often. Now the second, which tends to be more common among the gym crowd, is actually over-engaging the upper trap. Now you might ask yourself, what's wrong with over-engaging the upper trap? Well, when you're lifting heavy weights and you're over-engaging the upper trap, this is usually caused by compensating for a weakness in your core or ability to brace, which we'll address with some stability drills in a moment. Now, without further ado, let me walk you through my shoulder flexibility routine. Now, to gain flexibility, I do two things: tissue work and stretching. This is a great combination because tissue work helps to soften the tissue before stretching. Now, when it comes to tissue work, it's best to isolate the areas that you're experiencing tightness. As previously discussed, this could be your traps, your pec minor, or your teres. This can all be done with a lacrosse ball, a foam roller, and if your budget permits, a massage therapist. When massaging the upper trap, I like to hinge forward and find something like a pillar or a corner of a wall. While you're massaging any of these muscle groups, it's important to keep in mind that if you do feel a particular area that's very tender, that's where you want to spend the most amount of time. You can slightly stretch your neck as long as no pain occurs. The same goes for massaging the teres minor major. Another thing to keep in mind is to refrain from massaging too close to bony areas. Focus on the muscle in question. Now it's time to stretch. To save you guys some time, I'm going to mention at the beginning of this that we're going to be holding all of these stretches for 30 seconds, making sure that our scapula is slightly retracted. A cue that I like to keep in mind is to relax the trap while maintaining shoulder external rotation. Now we're going to start with some upper trap stretches, including the backpack stretch. For this one, you want to start with a moderate resistance band, anchor it somewhere low, and let it rest atop your shoulder. From here, we're going to gaze up and slowly begin to gaze down to the opposite side until we feel a nice stretch. Alternatively, you can hold a resistance band or some weight as you gently pull your head towards the other side. Now it's time to lay down on the floor and perform some neck stretches. You can do this for reps by breathing in on the way down and out on the way up. This foam roller stretch is one of my favorites, and this is one that I probably do almost every day. Be sure to really feel this one out and go within your range of motion and comfort level. A cue that I like to keep in mind is touching your chin to your chest. If you don't have the range of motion, don't worry, but just keep that cue in mind. Now for the sleeper stretch, you want to lay on your side and begin to provide a bit of resistance using your other hand until you feel a slight pull. This greatly improves shoulder internal rotation by targeting the infraspinatus and the teres minor. Now it's time to stabilize the joint. These are my 5 favorite ways to do so. The first is scapula lateral raises. It's best to prop yourself up on a box or a bench. Start with a very light weight such as 2.5 pounds and let your arm hang freely. Begin by retracting your scapula, pulling it down, and then slowly working your way up to 10 reps. It should also be noted that tendons can be significantly strengthened by utilizing slow eccentrics. So keep that in mind during all of these exercises. The lock 3 routine is number 2 and goes as follows. Start by laying prone with your palms facing up. Think about pushing your chest away from the floor as you retract your scapula. Lifting your palms while engaging the lower trap without the assistance of your upper trap. You can use a light weight for this, anywhere ranging from 1 to 3 pounds. Working your way up to 10 reps or failure, whichever comes first. Repeat with your palms facing down and then hands out to the side. Number 3 is scapular engagement. As far as scapular engagement goes, I really like practicing this because it taught me so much about how to properly engage my scapula in different lifts and exercises. You can start off by practicing protraction, retraction, and then eventually just working it out side to side, up and down. Another great way to learn scapular engagement is by doing scap pull-ups, or active or passive hanging. I would have liked to have had more shirtless footage to better illustrate scapular movement, but unfortunately, the tarps had to stay on at the gym. But on the low, guys, if you want more shirtless content, subscribe to my OnlyGrams. Another 2 warm-ups that I do almost every day are upside down kettlebell walks and hollow body side planks. These 2 are great because they teach us not only how to stabilize with the shoulder joint, but also with the core. For the upside down kettlebell walk, you want to start off with a light weight that's going to challenge your stabilizers. It should feel uncomfortable to start. If it's too difficult, you can bring your arm down to a 90-degree bend. While doing this, you'll likely experience some upper trap engagement, so you want to teach yourself to relax the upper trap and stabilize by bracing with the core instead. To learn proper bracing, relax your core and push your thumbs in just above the hip bone. A proper brace will drive your thumbs outward. The side plank hollow body hold is another amazing exercise. Now, despite how easy it looks, this can be a very challenging exercise, especially if you're new to this. You can start by just holding a side plank and then eventually holding it with an extended arm to increase the demands for stability. And then eventually, when you're ready, raising a leg to make it more difficult. During this hold, try to maintain a hollow position throughout the entire body, squeezing your glutes, core, and hip flexors to keep yourself aligned. Similar to a handstand, you're going to want to think about gripping the ground with your fingertips. But if you're looking to isolate specifically the teres minor and infraspinatus, banded external rotations or face pulls can be great warm-ups as well. It's also worth noting that cardio can work wonders for healing injuries by increasing blood flow. There are many other benefits as well, but that's a topic for another video. Now, while we did do some work to strengthen and stabilize the joint, why stop there? You and I both know that if your goals are centered around lifting more or getting stronger, we need to strengthen and stabilize this thing for good. Now, in doing so, my recommendation is to train with rings as much as possible, whether that's training pull-ups, push-ups, rows, etc. If you want some ideas on how we can progress with ring training, I've left a couple links down below. Another goal would be to start partaking in isometric exercises, such as handstands, planche training, or front lever progressions. Isometrics have been shown to significantly improve tendon strength, and these exercises also greatly improve scapula stability. So it's a win-win. As always, guys, I really hope this helps get you stronger and back on the right track. If it does, please come back and drop a comment. I'd love to hear about it. I myself struggled with this for years, and I know it's not easy, but with the right mindset and the right exercises, anything can happen. Hey guys, if you like this video, then you'll love the next one. Subscribe, and don't forget to smash that like button for the algorithm.